Jeepers, this is worse than the father of the bride speech. Decent meal, and I've done a couple of those. Decent meal and alcohol, and I haven't been able to, well, I've had a little bit of it. I'm Rob Mackay. I'm 69 years old. I'll stand back a bit. I'm 69 years old. I'm a retired GP, and I've been stage 4 since 2010, and I think I'm a really, really lucky guy. I thought I was really lucky in 2005 when I first had my melanoma. Now, you've heard men have melanomas on the trunk and women have them on their leg, so you'll be glad to know I'm in touch with my feminine side, and mine was on my leg. It was removed here in Bristol by Prof. Reed, big wide excision skin graft, and I was told 99% chance, complete cure, over 99%. So I thought, brilliant, and I got on with the rest of my life. In 2008, I found a little lump on the side of my scar, and I was due my follow-up with the dermatologist, my annual follow-up with the dermatologist, because I had such a good prognosis. And I was lucky, really, because Prof. Reed had retired, so I didn't have to come down to Bristol, and I was sent to a wonderful surgeon in Cheltenham called Charlie Chan. Some people may, if they know the area, know Charlie. He is a brilliant man. He, in fact, was a breast surgeon, but he'd been given the job of cutting bits off melanoma patients. And so he started cutting bits off me. And he took that bit off with another wide excision, and he gradually took more little bits off my leg as it sort of went upwards. And so I became stage 3, and he thought perhaps I ought to see an oncologist. And I saw an oncologist, and I have to be careful here. My daughter has been through that same department recently with breast cancer and has had brilliant treatment. I didn't have brilliant treatment. It was before the department was redeveloped. It was overcrowded. It was very, very busy. And I was put on high-dose interferon trial. Interferon is horrible. I felt dreadfully ill with it. I had to go every day for an infusion, every day for 4 weeks. And because the place was so busy, I don't think anybody knew who I was when I left. What have you come for today? And, oh yes, what your name was? And the receptionists, you know, I have a huge amount of sympathy for receptionists. I, after all, was a GP. But the receptionists, because it was so busy and because the waiting room was overcrowded and because you had to stand for ages because there were no seats, the receptionists adopt that receptionist position where they say, yes, and because they know eye contact is going to give them a load of abuse. And so I had sympathy for them, but it was not a nice experience. And it didn't do any good anyway, because by 2010, Charlie Chan, by the way, had decided against guidelines that I should have an annual CT PET scan. Very expensive procedure, and it wasn't really supposed to do it on the NHS. You may not be surprised to know that Charlie Chan actually doesn't work in the NHS anymore. He's moved out of the NHS because he didn't like the way things were going. But my CT PET scan showed that I'd gone to stage 4 with pulmonary and abdominal mets. Wasn't actually surprised because I'd been coughing rather badly and bringing up some blood, which I hadn't told my wife about. And he said, this was early 2010, beginning of 2010, and he said, I'm sorry, Rob, there's not a lot more I can do for you as a surgeon. But I was really, really lucky because he'd given me one piece of advice, which was I was able to take to my oncologist when I went to see him. And my oncologist, you talk about listening to the patient. He talked constantly, and he showed me my scans, and he pointed out where all these metastases were, and that was really exciting to see all these things that were going to kill me. And he said I probably wouldn't last more than a year. And really, well, he could offer me some dacarbazine, but it didn't really look like it would work. So the best thing he could do was he gave me his card and said, if your cough gets really bad, give me a ring and we might shine some rays on you, and that might make your cough a little bit better. But because Charlie had given me this brilliant piece of advice, Mark Middleton, was his houseman when he was a surgical registrar. And he said, I think you should see if you can go and see Mark Middleton in Oxford. I gather he's doing some quite good stuff. So I said, I wonder if you could refer me to Professor Mark Middleton in Oxford. And he said, well, okay, if that's what you want. So I went to see Mark and at the Churchill. And wow, this was different. I went there for my first outpatient appointment, and the receptionist looked up at me and smiled and said, good morning. I hadn't had treatment like that before. And Mark was brilliant, and he explained everything. And he said, let's put you on a trial. So I started on the DOC-MEC trial, docetaxel and a MEC inhibitor. But it was a placebo trial. You either got the docetaxel and a MEC, or you got docetaxel and a placebo. I was on that for a while, had all the nasty chemo side effects, but it became increasingly clear that I was on the placebo, and my disease progressed a bit. So he came back. He says it was 2009, I think it was 2010. He came back from ASCO, where the IPI results had just come out. And he said, I don't think it's ethical to keep you on this trial anymore. We haven't got an IPI trial going, but I've got access to this drug under the extended access scheme, so I think you should go on that. So I did, and it was wonderful. Cleared my lungs completely, destroyed my pituitary, but that was a small price to pay. The registrar, lovely Nash, the lovely registrar, picked that up immediately, so there was no delay in that, and I take my little cocktail of hormones, and I'm fine. And that kept me clear. It stabilized my abdominal mets, but my lungs completely cleared by IPI. And so I was okay for a couple of years, and then one of my abdomets started getting a bit bigger again. So I went on nivolumab. But probably I was it was getting a bit aggressive, and one of these abdomets was beginning to interfere with my bowel, and that began to make me really quite poorly, and the surgeons were consulted because something had to be done, otherwise I wouldn't have survived. Now, the surgeons were very good, but they said the best thing to do would be just to do a palliative operation, bring the bowel out for service, have a colostomy, and, well, not a lot of point really in doing anything more in somebody with stage 4 melanoma. Now, probably that was a reasonable thing to say in 2013, but Mark wasn't having anything of it. And he... He wanted them to do something better, and he just happened to have a group of Australian surgeons in oncology and melanoma specialists who were in the hospital for a conference, and they presented it to these Australians, and to use the words of the registrar who told me the result, he said, the Australians all said, oh, well, we can cut it out, mate. And so the surgeons agreed to cut it out, cut my tumour out, and they removed a melon-sized lump from my abdomen, locked my bowel, ileostomy, but basically they cured me. So I went on with the nivolumab, but it gave me problems with my liver, so high steroids, which I had for a long time, and I got high steroids, side effects, and I have an osteoporotic fracture of a vertebra, so I'm now about an inch and a half shorter than I used to be. So eventually I had to stop that. But it was okay, and sort of stable, until these abdomens started increasing again, and so a year ago I went on another trial. I get lots of money for all these trials because you get expenses paid. And I've now been on IMCGP 100 for a year, and I have stable disease, and I'm doing very well. So my conclusion, sorry, I haven't quite finished. The conclusion I have is that I'm very lucky because the timing of my time to go to stage 4 meant that I just got in on the start of all these new exciting drugs, and also I didn't have any problems with whether the drugs were approved or not, and the people having problems now of whether they can get them through NICE, because I was getting them all as trial drugs, and I still am. I was really lucky because my surgeon happened to know where to send me. I think I might have found my way to Mark eventually myself, but he was able to do that. And it shouldn't be about luck, should it? That's what this conference is about. And I think we all owe a huge debt of gratitude to Imogen for this, and let's hope that the word goes out and more people with melanoma do begin to understand that they have a right and they need to know what's going on. So thank you, Imogen. Just one final thing. One point my wife said to me is she is quite cross with me from going here. It may be because my huge mortgage-related life insurance ran out a couple of years ago and I'm still here, but she said, "Why are you going? You're making melanoma the center of your life." And actually, melanoma is not the center of my life. It was for a short time when I went stage 4. The center of my life is my family, my children, my grandchildren, my golfing partners, and all the rest of it. And we all have to approach this disease in different ways, but I think there is a danger of making it the center of your life. And I would plead with people, the future is good. I think I'm going to live with melanoma for the rest of my natural life. And it may be melanoma or it may be something else that kills me. And I don't want melanoma at the center of my life, even though I've got it.